Hey, it's Dr. Miller for Post-Op Thursday with a good example of a preservation rhinoplasty or preservation dorsal reduction technique. So let's take a look. This gentleman came in and he really just wanted this portion of his nose reduced. He wanted that brought back. Now, traditionally, there's two ways to do that, right? And let's take a look over here. I've done this in a separate video, but let's rehash. If we're starting with, let's say, a big Q-tip and I want to make a smaller one, there's two ways to do it. One way would be to go ahead and just break it off at the height that I want it to be. But then the problem with that is I lack the contour. I got to pull out some cotton. I got to wrap it around there, right? So that's sort of one way of doing it. The other way of doing it is, hey, let's preserve the actual contour of the Q-tip. Let's take the bottom portion out and then figure out a way to pull this down here so that I get from a larger Q-tip down to a smaller, shorter Q-tip. And that's what I did with this gentleman. Instead of taking the bump down, what I did is I took an area underneath the bump down and then pulled it down. So here he is now, just 1 week post-op, a little swollen, but otherwise we can just take a look and see that he has no bump anymore, right? And I mean, a little swelling right here, but no bump, very, very nice and straight compared to what he had before. And that technique that I used by pulling it from below also leaves him with a lot less swelling, and it retains the contour of his front view so that he doesn't have any irregularities. That contour stays the same. And perhaps most importantly, how's your breathing?
Great. Even right after surgery, I can breathe, which is great.
And that's great.
Yeah.
Terrific. And yeah, very little bruising, very little swelling, almost no bruising, just little swelling. And then post-operatively, all I'm going to have him do is just wear a little tape along the bridge of his nose just to keep that in place while he continues to heal.